Alright, my name is Drew Raby. I'm going to be doing a musculoskeletal neurological exam on my patient Alex here. I'll first start by feeling her radial pulses and just making sure they're equal and they're both strong bilaterally. And then I'll feel her brachial pulses. And they are also equal and strong. And then I'll test her hand strength. So if you could just squeeze my hands as hard as you can. Good. Okay, really strong. Alright, and then we'll test range of motion of her hands. So if you could just put your hands out, extend your fingers, put them back together. Good. And now if you could just rotate your wrists. Good. Range of motion is intact there. And we'll test your elbow here. So if you could just flex your elbow and extend. And then if you could just put your hands out like this and then turn them the other way and turn them the other way. Pronate and supinate, that's intact as well. And then if you could just abduct your arms out like this and then adduct back. And then if you could extend your arms up to your head and then back behind you. Good. And then we're going to test internal and external rotation. So with one of your arms, touch the back of your neck, and then try to touch the other scapula behind your back. Okay, and do that with the other arm too. Alright, so range of motion of her arms, hands, elbows are intact. Then I'm going to inspect her lower extremities. I'm looking for symmetry in her lower extremities, so if you could just stand up for me. Alright, looks symmetrical. I'm looking for skin characteristics, just doing a full inspection here, looking for hair distribution, which obviously there's no hair. And I'm also looking for varicose veins, and I don't see anything like that. I'm going to palpate behind her joints. I'm just feeling for any gross deformities. I didn't notice any redness or swelling, inflammation, anything like that. And I don't feel any gross deformities. We'll also do that on our elbows here. I don't feel any there. I don't feel any there either. And then we will palpate her pulses, her popliteal pulse behind her kneecap here. Those are both strong and equal bilaterally. If you just sit down for me, I'll feel her tibial pulses. Strong and equal, and then pedal pulses. And those are both strong and equal as well. After that, I'm going to test for range of motion in her hips. So if you could just lay back for me, turn on your side. And with this leg, straighten it out, extend your leg, and then back this way. Good. And then if you could turn on the other side. Do the same with this leg. Alright, perfect. Alright, now we will do abduction and adduction. So if you can lift your leg out for me. Yep, and then back in, and then with the other leg. Okay, and then with one of your legs cross midline, and then go back. Okay. And same with the other one. Alright, and then we will do external and internal rotation. So sit down again for me, lay on your back again, and straighten one of your legs, and then put your foot right up here. And we're just going to bend your leg this way, that way, and then put that leg down. Same with this leg. You can sit back up. Then we're going to do the other leg. We're going to do extension, flexion. Same with this leg, extension and flexion. And then with your ankle, if you'll just rotate your ankle like you did with your hand. Good. And do with that other one. Good. All right. All of our range of motion looks like it's intact. And then I'm going to observe her spine. So if you want to stand up for me, face that way. Your shoulders look even. And then I'm just going to have you bend over and almost touch your toes. And I'm just looking for the curvature in her spine, It looks fine, and you can go ahead and stand back up. And I also noticing an S curve of her spine, which is normal. And then I had her flex forward, I'm gonna have her extend backwards. Okay, that's good. And then if you just twist your back, yeah, and the other way. Okay, and the last thing I am going to have you do is just kind of laterally bend to one side, then do it to the other side. All right, range of motion is intact with her spine as well. Then I'll be moving on to the neurological exam. I'm going to assess Babinski reflex. So I'll just get a pin right here, and if you'll just kind of raise your leg for me, I'm gonna test for the Babinski reflex. I'm just gonna lightly press on her foot. I'm looking for any flaring of the toes, which I don't see anything like that. And we'll do it with this leg too. All right, same there. No flaring of the toes or anything. And then I'm gonna have you stand up for me. We're gonna do a Romberg test, and so just stand straight out like this and close your eyes. She's gonna hold that for a few seconds, and we're looking if there's any drifting, and I don't see any. And then we're gonna do a pronator drift. Okay, that's good, that's intact as well. And then I'm gonna have her walk for me, so if you'll just face that way. All right, then I'm gonna assess her tandem walking. We're assessing for coordination. So if you'll just walk heel to toe for me a few steps. And then come back. Okay, and now face that other way too, and just walk on your tiptoes for me. A few steps, and then on your way back, walk on your heels. Okay, and then I'm just gonna have you bend at your knees, back up, and then do it one more time. Okay, perfect. And then I'm gonna have you sit down for me. We'll do rapid alternating movement. And so what I want you to do is bring your hands up like this, turn them over, and slap your legs. And then back up, slap your legs. Okay, so go ahead and do that for me. Okay, perfect. Finger to nose test. So you're just gonna touch my finger and touch your nose, and I'm gonna be moving my hand all over the place. So touch my finger, touch your nose, and we'll go as fast as you can. Perfect. Okay, now if you'll just lay back for me. And straighten your legs, both of them. And then if you run this heel along this shin and back down. Okay, and do it with the other leg too. All right, and you can sit up. So her range of motion seems to be intact, or coordination seems to be intact, and movements. Then I'm gonna do deep tendon reflexes. We're gonna start by doing the brachioradialis, and I'm just gonna put my finger here. And if I had a hammer, I would use it, but I don't. So I would just hit my thumb right here, and her thumb would react that way. And then we are gonna do the same at the brachial point, and her thumb would do the same thing. And I would test both sides to make sure they would both react the same way. And then we would do the patellar reflex, and her legs would be dangling, they'd be free hanging, and I would strike her her knee right here, right beneath the patella, and I would strike her knee right here, right beneath the patella, and it would react that way, and I would do the same with the other one. And then I would do the Achilles reflex, and I would just strike her Achilles right here, and her foot should move. And the same with the other one, and her foot should move. Then I'm gonna do, since I'm gonna test her sensation, I'm gonna test it on her face, hands, legs, and feet. And so I would get an object that has a sharp end and an object that has a dull end. Usually use a Q-tip, break the end off and use that as the sharp end. And then I would just touch her face with the sharp end. I'll ask her, does that feel sharp or dull? And she would tell me. Would do the other side, is that sharp or dull? And she would tell me. Do the same with the hands, sharp or dull, same with both hands. And then I would do it on her feet as well, sharp or dull. And she would tell me, and she tells me correct, her sensation's intact. So So that concludes my musculoskeletal neurological exam. Thank you for watching.